Wipe the abdomen with hot towel. Put electrode pad under customer's back to make it fully touches the skin. Apply RF gel evenly on abdomen. Caress in circles 3 to 5 times. Operate with XL probe. Move the probe clockwise in circular motions around the level with one hand, 2 times. Hold the probe with one hand, the other hand moves together with the probe. Move back and forth in right-left order on abdomen as if writing Z, 2 times. Please note the probe touches the skin all the time. Lift when moving upwards, use no strength when moving downwards. Lift back and forth from waist to groin 6 times. Lift the other side of the waist. Move back and forth in right-left order on abdomen 3 to 5 times. Move in big circular motions on abdomen 3 times. Move the probe in a fixed point in small circular motions on abdomen 3 times, and then move to another area. Wipe clean the abdomen with towel. Take out electrode pad, wipe it and the probe with normal saline for next use. Do not use alcohol. Wipe the back with hot towel. Have the customer lie on the stomach. Put the electrode pad under the abdomen to make it fully touches the skin. Apply RF gel evenly on back. Caress back and forth 3 times. Operate with XL probe. Move the probe on 大椎 do 14 in circles in fixed points 5 times. Move the probe on scapula slot from 大椎 do 14 in circles with one hand. Move in circles on scapula slot with the other hand. Move both hands in sector 3 times. Move from scapula slot to waist with both hands in circles in sector 3 times. Hold the probe with one hand, touch the skin with the other. Lift from sides of waist to governing vessel to scapula in lines back and forth 3 times. Please note the probe and the hand touch the skin all the time. Lift when moving upwards, use no strength when moving downwards. Combine with hand. Lift the probe from the side of scapula slot along scapula slot back and forth 3 times. Please note lift when moving upwards, use no strength when moving downwards. The probe stays at 大椎 do 14 after lifting for 3 times. Hold the operating head with the other hand and lift from 大椎 do 14 to governing vessel back and forth 5 times. Then lift bladder channel back and forth 5 times. Move in circular motions on 肩颈 gallbladder 21 3 times. Slide on 大阪筋 back and forth 3 times. Operate the other side of the back. Wipe back with towel. Take out electrode pad, wipe it and the probe with normal saline for next use. Do not use alcohol. Wipe the arms with hot towel. Have the customer lie down on the bed. Put the electrode pad under the back to make it fully touches the skin. Apply RF gel evenly on the arm and armpit. Caress to the fingers 3 times. Operate with air probe. Put the customer's arm up. Move in circles on the armpit 5 to 8 times. Combine with hand, press the probe at inner side of the arm back and forth 5 to 8 times. Combine with the other hand, slide from armpit to elbow 5 to 8 times. Put the customer's arm down to operate the outer side of the arm. Apply RF gel evenly on outer side of the arm. Move the probe and caress in circles on the shoulder and move in circles back and forth on the outer side of the whole arm 5 to 8 times. Move the probe from outer side of the arm back and forth with both hands 5 to 8 times. Put one hand on the elbow, the other pushes the probe on outer side of the whole arm back and forth 5 to 8 times. Lift from outer side of the arm to shoulder with both hands alternately 5 to 8 times. Palm up. Apply RF gel evenly on the arm. Push up and down on the whole arm. Push downwards and use no strength when moving upwards. Push the upper arm and then the forearm. Then slide to the palm and move in 3 circles 3 times. Palm down. Push the probe up and down on the whole arm. Push the upper arm and then the forearm, then slide back and forth on the epistema to the fingers 3 times, and then lift from fingers to the shoulder. Wipe the arm with hot towel. Take out electrode pad, wipe it and the probe with normal saline for next use. Do not use alcohol. Wipe the leg with hot towel. Have the customer lie on the stomach. Put the electrode pad under the legs to make it fully touches the skin. Apply RF gel evenly on leg and feet. Caress from leg to feet 3 times. Operate with XL probe. Move in small circular motions on underside of the foot 5 times. Lift from poplite fossa to the whole calf back and forth 3 times. Lift from poplite fossa to the whole thigh back and forth 3 times. Lift in small circles from calf to the poplite fossa in lines back and forth 3 times. Move in small circles from poplite fossa to thigh root in lines back and forth 3 times. Move in circles with the prop. Caress in circles from calf to thigh in sector 3 times. Please skip the poplite fossa. Operate the other side of the leg. Have the customer lie down on the bed. Bend the leg. Apply RF gel evenly on the leg. Caress 3 times. Slide the prop from thigh in line back and forth on the whole leg 3 times. Slide the prop from knee to thigh root in lines back and forth 3 times. Slide from knee to calf to instep back and forth 5 times. Operate the other side of the leg. Wipe the legs with towel. Take out electrode pad, wipe it and the prop with normal saline for next use. Do not use alcohol.